Hey everyone, and welcome to this explainer. I'm absolutely thrilled to have you here today. Look, if you're a medical professional, whether you're a doctor, a nurse, a dentist, or a pharmacist, you already know that clear communication is literally just as vital as your clinical expertise, right? Well, today we're doing something really special. We are taking a standard, kind of basic clinical vocabulary list of high-frequency medical verbs, and we're transforming it into a highly practical toolkit. Our goal isn't just to memorize words. No way. We're here to build empathetic, precise patient communication that you can take straight to the floor and use immediately. We'll be looking at exactly how to use these words, the common mistakes non-native speakers tend to make with them, and most importantly, we're going to apply them to real-world patient scenarios. So, let's get into it.
To make these verbs truly memorable, we're going to learn them by walking chronologically through the 5 stages of a real patient's journey. We'll cover diagnosis and initial assessment, active treatment and procedures, medication management and prescribing, patient counseling and warnings, and finally, monitoring and recovery.
All right, let's look at this breakdown. By chunking these verbs into distinct clinical phases, diagnosis, treatment, and monitoring, we can instantly map them to your everyday hospital, dental, and pharmacy workflows. When you categorize language like this, your brain actually retrieves it much faster during a chaotic shift. And notice how each column requires a slightly different tone, right? You've got the investigative tone for diagnosis, the reassuring tone for treatment, and the watchful tone for monitoring. Okay, Section 1, Diagnosis and Initial Assessment. So, this is the very first encounter with your patient. Gathering information safely and accurately is your absolute top priority here. Let's look at some real patient scenarios and the common translation mistakes that trip people up with these high-frequency verbs. Imagine a patient walks in with severe abdominal pain. First, we need to take a history. A super common mistake here is translating directly from your native language and saying something like, "Let me take your background," or "I need to learn your past." Nope, in clinical English, the set phrase is always, "take a history." Next, before administering any pain meds, you absolutely must check for allergies. The mistake we hear all the time is dropping the preposition and just saying, "I will check your allergy." You have to check for it. Then, to investigate that abdominal pain, we might take an X-ray. We don't shoot or make an X-ray. Finally, we use all this data to rule out a serious condition, like appendicitis, meaning we safely conclude that it's just not the cause.
Now notice the shift here from a clinical objective to a real human connection. On the left, we have our goal, collect background info. But you'd never just march up to a patient and announce, "I will take your history now." It's just too robotic. On the right, we transform this into a polite, natural phrase. "Could you help me take your history?" By phrasing it as a cooperative request, you empower the patient. You instantly build rapport, which, as we know, actually leads to the patient opening up and giving you a much more accurate medical history. Let's step right into the shoes of a clinician and sequence these exact verbs in a fast-paced scenario. Imagine you're an ER doctor or a triage nurse. A patient arrives with a swollen ankle after a bad fall. Step 1. The patient is in the clinic. Step 2. Before you even think about painkillers, you check for allergies. Step 3. You take an X-ray of that ankle. Step 4. You review the imaging to rule out a bone fracture. By mastering this specific sequence of verbs, you can present this case clearly and professionally to an attending physician in under 10 seconds. It's that efficient. Moving right along to Section 2, Active Treatment and Procedures.
This phase is where we focus on the action verbs, the hands-on clinical interventions used by dentists, nurses, and doctors. Let's look at the pitfalls and the practical applications here. First up, give an injection. Imagine you're administering a local anesthetic before a minor procedure. Do not say, "make an injection," or "do an injection." That is probably the single most common translation error in medical English. You always give an injection. Second, apply a dressing, gel, or cream. While you could say put on, apply is the professional standard. For example, if you're treating a burn patient in the ER, you apply a sterile dressing. Finally, remove. Picture a patient returning a week post-op. Instead of saying you're going to take out their sutures, using the word remove to say you will remove their stitches elevates your professional tone immensely.
Let's bring these active verbs straight to the bedside. Procedures are scary for patients, right? Using these verbs in a gentle, reassuring sentence is incredibly effective. I'm going to gently give an injection now and then apply a soothing gel. Notice the addition of the words gently and soothing there. You're taking the clinical verbs give and apply and wrapping them in empathy to calm the patient's nerves before you even begin the procedure. The crucial takeaway here is understanding the sheer versatility of these verbs. Take the pattern remove plus object.
This single verb applies equally across completely different specialties. A dentist extracts or removes a wisdom tooth. A week later, an orthopedic surgeon removes stitches from a knee operation. A floor nurse removes a soiled dressing. Mastering this one verb unlocks your ability to describe dozens of procedures accurately across the entire hospital.
All right, Section 3, Medication Management and Prescribing.
We're heading down to the pharmacy and the hospital floors where medication instructions are delivered. Take medicine is the core instruction every single pharmacist and doctor must clearly communicate for prescribed or over-the-counter drugs. And I want to highlight a massive trap here for non-native English speakers. Depending on your mother tongue, you might naturally want to say drink your medicine if it's a syrup or eat your medicine if it's a pill. In English, this sounds very unnatural, and honestly, in some contexts, it can be confusing. Whether it's a pill, a capsule, or a liquid syrup, the verb is universally take. Imagine discharging a patient with a severe chest infection. You would confidently say, please take this medicine twice a day.
On to Section 4, Patient Counseling and Warnings.
This is the critical safety phase, guys. This is where your clear communication literally protects the patient from harm. When providing essential lifestyle advice, outlining risks, and escalating care, your prepositions are completely inseparable from these verbs. We advise against doing something harmful. A really common mistake is saying, I advise you not to smoke. While they'll understand you, I strongly advise against smoking is the clinical gold standard. Next, we warn about side effects. And if a case is just too complex, we refer to a specialist. For instance, if a patient is prescribed a strong sedative for anxiety, you must advise against driving, warn about drowsiness, and if their symptoms worsen over time, refer them to a neurologist.
Now, it can be really tricky to talk about risks without utterly terrifying the patient. Let's look at how to strike that perfect balance between being professionally direct and maintaining a warm, supportive bedside manner. Instead of a cold, robotic, here are the risks, using the polite phrase, I must warn you about some side effects, shows that you are an advocate for their safety. The phrase, I must warn you, frames the warning as your professional duty and care for their well-being, rather than just reading off a scary list of problems.
Let's role-play a quick scenario utilizing these counseling verbs. Imagine you're a general dentist. You spot a highly complex, impacted root issue on an X-ray. First, you identify that complex issue. Because the patient is in severe pain and was just given strong medication, step 2 is you advise against driving home themselves. Step 3, realizing the extraction is way beyond general dentistry, you refer to an oral surgeon or an endodontist. These precise verbs keep the patient totally safe and ensure they get exactly the specialized care they need.
Finally, Section 5, Monitoring and Recovery.
Our focus here shifts to post-treatment observation and the vocabulary we use to track a patient's progress. Once again, prepositions are your secret weapon to sounding like a native-speaking clinician. You don't just monitor a patient. Think of a patient on a brand new class of antibiotics. You monitor for adverse effects. When noting progress, a patient doesn't just respond. If you're charting a pneumonia patient whose breathing has significantly improved, they respond to treatment. And finally, a post-op patient doesn't just recover, they recover from surgery. Getting these small prepositions right instantly elevates your clinical chart notes and your handover reports.
Imagine waking up in a hospital bed feeling groggy and vulnerable. Hearing a comforting, highly professional phrase like, we will closely monitor for adverse effects while you recover from surgery, is exactly what a patient wants to hear. It uses our target verbs to clearly communicate two crucial things: vigilance, meaning we are watching you closely, and optimism, meaning you are actively in the process of recovering. It manages their expectations while providing deep, deep reassurance. The ultimate positive clinical outcome we ever get to communicate is when a patient responds to treatment. Imagine checking a patient's charts in the morning and seeing their fever has finally broken. Telling your colleagues the patient is responding well to treatment delivers the best news possible. It's a universal phrase perfectly understood in the dental clinic, at the pharmacy counter, and during morning medical ward rounds to indicate that the intervention is a success and it's actively working.
Well, we've covered a lot of ground today, from taking a history all the way to recovering from surgery. So I want to leave you with a thought-provoking challenge. Look back at the polite phrasing, the correct prepositions, and those crucial action verbs we discussed. Which of these patterns will you take out of this explainer and use in your very next shift? Just pick one or two to start. Focus on the correct preposition, wrap it up in empathy, and watch how it improves not just your English fluency, but your patient's overall experience. Thank you so much for joining me in this explainer, and I will catch you in the next one.